Saturday the 21st, I started having chills and everything, and so I moved into the other bedroom because I thought we both had the flu. And I thought, well, so did that, but it just, by Wednesday, it's all I could do to get out of bed, either of us. And then the following Monday, we just sat in the kitchen in there, and I said, we've got to go to the hospital. I was going to drive us, and she said, there's no way you could do that. So we called an ambulance, and I just looking at each other, we could tell we didn't have much time left. And, you know.
I couldn't walk to the ambulance.
Yeah.
I was so.
She got from the kitchen to the garage.
Out of air.
And then they put her on a stretcher.
They immediately took us to the emergency room, immediately started working on, you know, of course we were both hooked up to the IVs. They immediately started us on oxygen.
Yeah, she was quite symptomatic and she was quite short of breath, and her oxygen requirement increased as well. Mr. Stone was luckily he did not get that sick, but Mrs. Stone was quite sick when we took care of her in the hospital.
I had the COVID, sepsis, and pneumonia.
Yeah, we both had pneumonia on top of all this, but she's the miracle girl.
Mm-hmm.
They separated us for that first week we were there. We could text back and forth, and we were doing that on our phones, but otherwise, you know, and I knew she was in the room right next door, but, you know, we were separated. Yeah.
My angel. His name is John. I can't. Sorry.
John Lohan.
He, when I was in isolation alone, he sat there and he talked to me. He showed a lot of compassion, which when you're in that situation, you definitely need it because you're so alone. Every day he would check on me, and he spent time with me.
We weren't allowed to have visitors for them, so that part I saw that they really need somebody to be there to talk to them, you know, and kind of get to know them a little bit, you know. And every time I have like some spare time, I just go into their rooms and just check on them. Nurses, sometimes we only look at the physical stuff that's happening to the patient, whereas we also have to like think about their emotional needs, which is a really big deal in boosting their morale so they could fight.
I've just never had that much compassion showed to me by a stranger. I asked him, I said, can I take a picture of you? And he said, well, you can't see me, because he had everything on. And I said, but you can see your eyes. I can see your eyes. People talk with their eyes. It's the, you know, it's your soul.
Everybody that we dealt with were just, you know, doing everything they could, and you could see the compassion and all. And talking about John, you know, just, I don't know about the rest of the hospital, but the 10th floor people are fantastic, you know, and something is there that's motivating them to be compassionate like they are.
I couldn't have asked for better care. No.
Yeah, it was fantastic. I say we contribute a lot of our survival to God, but those were his angels.
Mm-hmm. You know, how do you repay someone that has cared for you in a very bad situation? Mm-hmm. They put their life on the line too when they come in to see you. And for that, I commend them. They work hard. Every room that they walk into, they don't know if they're going to walk out with it. But no, I thank them tremendously. I can't say enough. I can't. How do you repay somebody like that? Yeah.
Thank you. Thank you from the bottom of our heart.